For medium acuity jobs, a full ePCR must be completed. This means that you may not just move over to the Results tab and select Pre-booked Routine Transfer to remove all the red dots. All tabs with red dots need to be opened, and all pink or red fields within these tabs need to be completed to complete a full ePCR. You might like to start with the Past History tab. You must include all past and current medical conditions that may be relevant to the patient's care and their current condition. You must also include the dates of occurrence and any relevant details as a comment. Allergies are to be included as per the low acuity case, with the inclusion of the alleged reaction to the allergen as a comment. All medications that the patient has taken that day, along with the dosage and the time of administration, must be recorded. Any additional medications that have been prescribed to the patient or medications that have been transported need to also be recorded. Risk factors do not need to be recorded. Under the History tab, mark the case nature as medical, or in the case of a fall or some other trauma, mark the case nature as trauma. The case description is arguably the most important field on the medium acuity ePCR. As with a low acuity job, the case description begins with an S.N.E code. But because it is a medium acuity job, the S.N.E code will be open square bracket, M for medium, T for rostered shift, close square bracket, and then how the patient was transported to the ambulance. The case description is a summary of all the important details of the case from start to finish. Unlike a low acuity ePCR, significant and relevant details regarding the case should be included so as to improve patient care and to be used as evidence in the case of litigation. Here you will include the patient's complaint, relevant chronology and times. You would also include notable factors pertaining to their condition, the management performed prior to your arrival, and their extraction. An example may be that the patient was carried down 3 flights of stairs with the help of a family member. In the past, this may have been included in the management section of a paper PCR, but now it makes up part of the case description. You may also record important statements made by the patient, bystanders, or yourself, and record any comfort checks or toilet stops made along the way. Finally, a summary should be included on how the patient travelled, such as patient travelled well or patient slightly irritated. Most details external to the case description are simply used as statistical data by AV. Because of this, do not use sticky notes all over the PCR. If you think it's worth mentioning, include it in your case description, not as a sticky note.